interview, part one, questioning how does society create a barrier for people with emotional and behavioral disorders, with Carol Lincoln. Carol, can you introduce yourself?
Yes, my name is Carol Lincoln, and I worked in mental health for 20 years, first as a supportive case manager and then as a crisis counselor.
Okay, so what barriers do you feel society puts upon people with emotional and behavioral disorders that negatively impacts their lives and the outcomes of their lives?
Well, the first big barrier is the lack of understanding and lack of knowledge about mental health disorders and emotional disorders. There's a great stigma attached to mental illness, and there are social barriers, and of course behaviors that are symptoms of the mental illness creates alienation for the patient or the client, and sometimes their parents also creates alienation in the community and creates education barriers, employment barriers. Sometimes, especially children, they learn differently and become labeled in the education system. And they have difficulty creating relationships in the community because of their symptoms and sometimes their appearance, unfortunately. Also, there's a lack of support, either or both, by the family and the community. And unlike if you have a physical illness, you are treated quite differently than when you have a mental illness, because sometimes with mental illness, it's very misunderstood, and it's thought to that the patient themselves creates the problem. If they have an anxiety disorder and act out, lose their temper, become paranoid, it's considered that you could do something about that. But if you are diagnosed with diabetes, you're treated quite differently. It's understood, and it makes a big difference in a person's life when they are labeled. And also, many patients feel very alienated. They feel insecure in society, and certainly they feel misunderstood. Children in school sometimes just don't fit in with their peers for different reasons. Sometimes it's their appearance. Maybe there's a learning disability involved. There's anxiety involved, especially with ADHD. Anxiety is one of the symptoms, and the behaviors are quite different than, say, children who don't have ADHD. And they also have learning disabilities come along with many of these disorders.
Do you feel that teachers are equipped or knowledgeable about students with EBD? And if not, is that a barrier?
I feel that some teachers are quite equipped to handle it and do understand the symptoms and how that child needs to be approached. And but there are some that don't, and that is a huge barrier because children sometimes learn differently because of their illness, and there isn't allowances made for that or other arrangements made for that child who does learn differently. Then also some children, especially with ADHD, act out in the classroom, and that's a big disruption in the classroom, and the other children don't understand it, and sometimes the teacher doesn't know how to handle it or feels physically sometimes in danger from that child. So there is that also, but schools are coming up with better ways to treat these children, which needs to go further, I believe. And these children do have a difficult time in school.
Now, for students and people that have the more internalized behaviors such as anxiety, depression, bipolar, are there specific barriers you find with those students and people?
Yes, many times people internalize, they try to hide from society their symptoms because a lot of insecurity comes with those symptoms, and they feel they're quite different from the rest of society. And know their differences. Someone who's depressed and can't get out of bed for several days feel a certain alienation. They feel very alone in the world. And it's very difficult for them to hold a job down because they can't get out of bed and physically go to work. People with anxiety feel very fearful, sometimes into paranoia, and they act out because of that. Maybe they are rude, or certainly they're misunderstood because they're hidden symptoms in a way, and society looks at them as that person is just a nasty person. They don't understand. With bipolar disorder, the swing in the moods is very difficult sometimes for maybe even family members to deal with that. And there are many barriers to good treatment, maybe some understanding, when someone has a physical illness, sometimes an employer can make allowances for that person. Maybe they can change their hours or change the work environment somewhat to fit their needs. But with someone with mental illness, not so. Usually, the person with mental illness will not tell their employer that they have this issue because of the stigma attached to mental illness. So therefore, many lose their employment, end up in the welfare system with very little resources. So there are many barriers, and even just to go for higher education, sometimes when you're in college level, it's difficult for professors to make allowances for somebody who does miss class several days in a row because they're too depressed to get up, or their anxiety levels are so high they can't deal with sitting in the classroom. It is difficult for these people to make a living, be accepted into society. They do feel alienated, and they are often alienated. As we can see on some of our city streets, we'll see somebody in the middle of summer going out with a big overcoat on, and maybe they're talking to themselves because they're hearing voices. And people just look at them with disdain. Who is that person? They're so dirty, and they look so, different than the norm, as we say. So there are many barriers to people walk around all day. I see it right in my community. One person in particular I observe, he walks all day long by himself, often talking to himself. So certainly people who pass by are thinking, these very negative thoughts about that person.
Okay, last question. So students and people with emotional behavioral disorders often do not have an outwardly appearance of what they're going through internally unless they have an aggressive out, tantrum or something to that extent. Do you feel that because often they look like the average person, that is a barrier as well?
Yes, it is. Because sometimes people do suffer in silence. They feel that we can't detect what somebody is actually feeling inside. We can't detect if someone's in physical pain. Neither can we detect sometimes when someone's in emotional pain. So oftentimes they'll go away by themselves. They may be contemplating suicide and nobody knows about it because they can't bring themselves to express the thoughts that they're having. They may be feeling high anxiety, but on the outside they are very calm. So it is a barrier because maybe sometimes they'll not participate in social activities and employment activities because they are suffering so inside, and they don't have an opportunity maybe, or they just cannot sit down and talk about it with someone. They don't feel comfortable expressing, oh, today I feel really depressed when they go to work. If you went to work and said, oh, today I have a migraine, people would be quite understanding. But if you went into the office and said, oh, I feel so depressed today, I don't know the level of understanding that would be there.
All right, thank you. That was very informative. That is the end of interview part 1.